In this video, we are going to cover the top to bottom, taking an overview. The basic bone of skeleton. Basic bone of skeleton. So, anatomy of skeleton. Top to bottom. That overview of basic bones of skeleton. Let's start by looking at the skull. The skull consists of bone of the head. Skull consists of bones of the head. The cranial bone surrounded the brain at the front is the frontal bone. The cranial bone surround the brain at the front is the frontal bone. At the top is the parietal bone and the back is the occipital bone. Beside the ear is the temporal bone. Anterior to the temporal bone is the sphenoid bone and that final cranial bone, which is a bit more difficult to visualize in the ethmoid bone, which is closer to the midline, posterior to that nose and inferior to that frontal bone. Cranial bone surround the brain at the front bone. The top is parietal bone. At the back, occipital bone. Beside that ear, temporal bone. Anterior to the temporal bone is the this one, sphenoid bone. The final cranial bone, which is bit more difficult. That one name is called as, this one is ethmoid bone. Ethmoid bone, which is closer to that midline. Midline posterior to that nose and inferior to that frontal bone. The facial bone from the structure of the face, the bone that form the bridge of that nose is the nasal bone. So this one is the nasal bone. The bone that form that bridge of the nose is the nasal bone. The bone that connect that nose, cheekbone and upper teeth is maxilla. So this bone will connect nasal bone that connect that nose, cheekbone and upper the teeth. His name is called as maxilla. Either side forming cheekbone are known as zygomatic bone. Both side, either side forming cheekbone name is called as zygomatic bone. Finally, the jaw bone is called mandible. Finally, this jaw bone name is called as mandible. The mandible connect to that temporal bone at the temporomandibular joint. So this one name is called as temporomandibular joint, TMJ. Facial bone that form that bridge of the nose is the nasal bone. The bone that connect nose, cheekbone and upper teeth is maxilla. Either side forming cheekbone or that zygomatic bone. Finally, jawbone is called as mandible. The mandible connect to the temporal bone at the temporomandibular joint, TMJ. Next, let's look at the spine. The spine is made up of 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the thorax. Vertebrae is the vertebrae is the sarcum. Then coccyx. Vertebrae are numbered from top to top down. Okay, they numbered from top down. C1 connect to the base of that skull. This is followed by C2, C3, C4, C5, C6, C7, which connected to the first thoracic vertebrae called T1. Then get T2 to T12. Then L1 to L5. Then circum C1, C2. That C1 and C2 have special name. C1 called Atlas, and C2 name is called as Axis. So next one is spine. That spine is made up of 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the thorax, 5 lumbar vertebrae in that then sarcum and that cos coccyx. Okay, coccyx. Vertebrae are numbered from top down. C1 connected the base of the skull. It is followed by C2, C3, C4, C5, C6, C7, which connect to the first thoracic vertebrae called as T1, then get T1 to T12, then L1 to L5, and this sacrum C1 and C2 having that special name. C1 have that name Atlas and C2 having Axis. Next, talk about that upper limb. So upper limb. Upper limb, the clavicle lies horizontally between sternum at that shoulder at the front and upper portion the chest. The clavicle is commonly called as collarbone. The spatula is the flat triangular shaped bone at the back, commonly called as shoulder blade. So in this one, upper limb clavicle lies horizontally. This one is the sternum and the shoulder at that front upper portion of that chest. That clavicle, this clavicle is commonly called as collarbone. The spatula is the flat triangular shaped bone at that back, commonly called as this one only shoulder blade. The humerus is the name of the bone of that upper arm. On the scapula, there is a concave area called as clinoid fossa. Clinoid fossa. The concave area name is called as clinoid fossa, and the head of that humerus meet this clinoid fossa to form a glenohumeral joint of the shoulder. If we move further down, that humerus meets the radius and ulna bone at the elbow joint. The humerus is the name for the bone of upper arm. On the scapula there is a concave area, name is called as clinoid fossa, and the head of that humerus meet the glenoid fossa to form the glenohumeral joint of the shoulder. If we move further down, humerus meet that radius and that ulna bone at that elbow joint. Looking bit closer. So looking bit closer at that wrist, that radius and ulna connect to the corbel bone. This one will connect it to the eight of this corbel bone. There are 8 corbel bone. The corbel bone connected to the metacarpal bone. This one will connected to the metacarpal bone. The metacarpal are numbered 1 to 5. 1, 2, 3, 4, 5. From the thumb to the little finger, meaning that is first metacarpal is at the base of that thumb. Okay, the fifth metacarpal at the base of that little finger. The fingers and the thumb containing phalanges. So the fingers and the thumb containing phalanges. Each finger has a proximal phalanx, middle phalanx, proximal middle phalanx, and this distal phalanx. The thumb only having that proximal and distal phalanx. If we move from the base to the tip of each fingers, there is a metacarpophalangeal joint. So here metacarpophalangeal joint is present. That one name is called as MCP joint. Proximal interphalangeal joint. Proximal interphalangeal joint. PIP joint. At the base, the thumb is the metacarpal joint. CMC joint. So carpal bone connect to the metacarpal bone. The metacarpal are number 1 to 5 from the thumb to little fingers. First metacarpal at the base of the thumb. Fifth one is little fingers. The fingers and the thumb containing phalanges. Each finger has proximal, middle and distal phalanx. The thumb only having proximal and distal phalanx. Base to the tip, each finger's metacarpophalangeal joint, MCP joint, proximal interphalangeal joint, PIP joint, then distal interphalangeal joint, DIP. Base of the thumb is the carpometacarpal joint, CMC joint. So next one is thorax. Let's move on to thorax. At the top of the thorax is the clavix. So clavix, which attached to that sternum. So this one will attach to that sternum. At the sternum, clavicular joint. So here we have clavicular joint. At the top of that sternum is called as menuprium. This top name is called as menuprium. This attached to that body of that sternum at the sternal ankle. So this one attached to the sternal ankle. At the very end of that sternum, there is a small bone name is called as this one xiphoid process. So this small bone name is called as xiphoid process. These are 12 rib. These are the 12 rib. For each thoracic vertebrae, these rib are labeled 1 to 12. 1 to 12 corresponding to that vertebrae. They attach to the costal cartilages or what connected the rib to that sternum. The 11th and 12th rib does not connected to that costal cartilage, not connected to the costal cartilage or to sternum. They are called as floating rib. These two are considered floating ribs. So at that top of the thorax is the clavicle which attached to that sternum. At that uh, sternoclavicular joint, the top part of the sternum is called as maniprium. Maniprium. This attached to that body of that sternum at that sternal ankle. At that very end, the sternum, there is a small bone name is called as xiphoid process. Xiphoid process. There are 12 ribs, one for each thoracic vertebrae. The ribs are labeled 1 to 12 corresponding to that vertebrae. They attached to that costal cartilages are connected to the rib of that sternum. 11th and 12th does not connected to that costal cartilage. Not connected, so they have the name floating rib. Next, move to pelvic. Pelvis is made up of three main bone. That ilium bone, ischium bone, ilium bone, ischium bone, and pubis bone. Pubis bone. It is made up of three main bone: ilium, then ischium, and pubic bone. One either side at that front of that pelvis. The pubis bone joint at the center. Both side it is joint at that center. At that pubic symphysis. This center name is called as pubic symphysis. Pubis, this one two part jointed here bone is presented, that name is called as pubis symphysis. Inferiorly there is this ischium, the socklet of that hip joint is called as acetabulum. Socklet name is called as acetabulum. This is located at that point where or three bone of pelvis are meet together. So these three bone meeting together, this place only acetabulum is present. So the pelvis having three type of bone: hilum, after that ischium, and pubis bone. The base of that spine is the sarcum. The sarcum attached to that ilium of the pelvis at sarcoiliac joint. One either side at that front of that pelvis is that pubis bone. The pubis bone joint in the center at that pubic symphysis. Inferiorly there is ischium. Socklet of that hip joint is called as acetabulum. This is located at the point where three bone of that pelvis meet together. They are located. Next, move on that lower limb. Longest bone in that body is that femur. Longest bone in body, femur or thigh bone. The head of that femur connected to this acetabulum. This one will connected to that acetabulum of that pelvis in order to form hip joint. That femur joined with the tibia. This one will jointed with the tibia and the fibula at that lower leg to form knee joint. The tibia is medial closer to the midline and that fibula is lateral on that outer aspect of that leg. Longest bone in that body, femur or thigh bone. The head of that femur connected to the acetabulum of that pelvis in order to form hip joint. The femur join with the tibia and that fibula at the lower leg to form the knee joint. The tibia and media closer to that midline. And that fibula is lateral on that outer aspect of that leg. At the front of the knee is the patella bone, which is commonly called as knee cap. So patella, this one name is called as knee cap. Finally, let's move on that ankle and foot. This one is the ankle, this one is the foot. At that ankle joint, this one is the tibula, this one is the fibulae. Meet with this bone name is called as dorsal bone of the foot. There are 7 dorsal bone here, 7 dorsal bone. The thallus, this one is the thallus which join the bone that join directly to the tibula. This one directly join to that tibula. And that bifula at that ankle joints. The calcaneus, cuboid and the navicular and 3 cuneiform bones. 3 cuneiform bones. So cuboid, navicular, calcaneal and 3 cuneiform bones. Distal to the dorsal bone or the metatarsals. These are the numbered 1 to 5. Numbered 1 to 5. With the first metatarsal joint, the big toe, and the 5th metatarsal joint, little toe. Distal to metatarsal are that phalanges. These are the proximal, middle and distal phalanges except for the big toe, which only having proximal phalanx and distal phalanx. Distal to metatarsal are the phalanx. There are the proximal, middle, distal phalanges except the big toe. Notes format: ankle joint, tibia and bifula meet the dorsal bone and of that foot. There are 7 dorsal bone. The talus, which is the bone directly jointed with that tibia. So here, what are the bone? Calcaneal, cuboid, navicular, cuneiform. Distal to dorsal bone or that metatarsal. There are that numbered 1 to 5. With the first metatarsal. Join big toe and 5th metatarsal joining to the little toe. So this one, distal to metatarsal or the phalanx. These are the proximal, middle and distal phalanx except big toe, it having only proximal and distal. So this is all about normal skeleton that skeleton of bone, top to bottom overview of basic bone of skeleton. Thanks for watching.